Hello, and welcome to today's webinar, Who's Doing What? The Epidemiology of Adolescent Substance Use. I'm Tracy McPherson, and I will be your moderator for today's event. This webinar is produced in partnership with the Network Coordinating Office, EMERSA, and the Adolescent Expert Project by NORC at the University of Chicago. This webinar is part of the Transitional Age Youth webinar series. And as you can see, there are a number of other webinars on this very important topic, and including is the impact of substance use on the developing adolescent brain, substance use interventions for adolescents and transitional age youth, and integrating loss and grief into the expert model. We hope that you'll take advantage of these and share information with your colleagues. You may also want to consider offering them as part of your efforts to train other practitioners, including those currently in the workforce and the future workforce of pre-service professionals. You can access everything for today's webinar at the website on your screen. You can do that now. You can do that in the future at expert.webs.com/adolescent-epidemiology. Our team will also be sending you a follow-up email later today, and it includes links to the PowerPoints, the on-demand recording, a very brief survey, and instructions on how to claim your free CE certificate. And this webinar is approved for 1 CE through NADAC. You can access the PowerPoint slides through the Handouts pane on your GoToWebinar platform, on your computer or your mobile device, or you can download them directly from the website. You can also ask questions at any point. You can use the chat pane of your GoToWebinar control panel on your computer or your mobile device, and we will post the answers to those questions on the website. Now it's my pleasure to introduce Dr. Veronica Masharikova, who is an assistant professor of pediatrics and adolescent medicine at the University of California, San Francisco, or UCSF, and the director of the UCSF Youth Outpatient Substance Use Program, a multidisciplinary, family-based program that provides comprehensive assessment and evidence-based outpatient treatment for youth with substance use disorders. She also directs the UCSF Youth Addiction Management Training Program, which offers training in youth-specific addiction treatment to UCSF professional trainees, including fellows, residents, medical students, nurse practitioners, social workers, and clinical psychologists. So welcome. I will turn it over to you, Veronica, and we look forward to hearing what you have to share with us today.
Thank you so much for the kind introduction, and it's my pleasure to be here with all of you today, speaking about one of my favorite topics. So let's jump into what I hope to cover today. And I'm hoping that after this lecture, all of you will be able to discuss trends in the identification and treatment of adolescent substance use, describe the implications of adolescent substance use, outline substances most commonly used by adolescents in this country, and relate how the family and positive social supports serve as protective factors. So I'm going to start with a zoomed out vision of why adolescent substance use and addiction is important before we really zoom in and talk about the epidemiology and the use trends. And I'd like to start with a case. Now, because of the sensitive nature of this case, the name, the age, and other identifying characteristics have been changed, but otherwise, this story is a true story from a patient that I worked with in our youth outpatient substance use program. So Brianna is a 16-year-old young woman who moved to a new town with her family and presented to establish care with a local pediatrician. During that initial visit, her chief complaint was insomnia, fatigue, loss of appetite. She also reported that she thought she lost about 20 pounds in the last several months. She reported that she quit her volleyball team and has been failing her classes. And she did report to the pediatrician that she had been using cannabis to help with some of her insomnia that she was experiencing. At that time, a diagnosis of a depressive disorder was made, and Brianne was started on fluoxetine. 2 weeks later, Brianne came back to the pediatrician's office and reported actually doing a bit better in school. She was feeling less irritable and was sleeping a bit better as well. And she was very excited about a family trip to Europe, but expressed significant worry about flying. So her pediatrician discussed some non-pharmacologic options and prescribed alprazolam for flight anxiety and counseled the parents to keep the medication locked and in their possession at all times. So 2 months later, Brianne came back for another follow-up visit. She had a great time on vacation, reported that her mood was much better. And she stated that while she was on vacation, she hadn't been using cannabis at all because she couldn't access it while in Europe. So overall, this sounded like a pretty positive outcome. Unfortunately, there's more to this story. About 6 months later, Brianne continued to struggle with school and started coming home visibly high. She eventually admitted to her parents that she had been using opioids that she purchased from friends. And during a private interview, Brianne reported that she had a 4-year history of substance use that initially started with cannabis, but later came to include nicotine, alcohol, cocaine, LSD, and various prescription medications that she purchased from friends. And eventually she was diagnosed with opioid use disorder, cannabis use disorder, benzodiazepine use disorder, and stimulant use disorder. Now, what's interesting here is that by the time that Brianne's substance use disorders were recognized, things had gotten pretty serious. Her parents were so worried about her that they were sleeping in her room because they were worried that she would die in her sleep when she came home visibly impaired. So how is it that these serious diagnoses went undetected for so long? Well, what we know about detection and treatment of youth substance use disorders is that less than 50% of pediatricians routinely screen adolescents for substance use. And a small fraction of those screen adolescents using a validated screening tool. And even when screening does occur, pediatricians tend to underestimate the severity of adolescent substance use problems. And I think this relates directly to the fact that adolescents themselves tend to severely underestimate the problems associated with their substance use. And one study even revealed that less than 5% of patients with problematic substance use were correctly identified in the healthcare setting. And furthermore, even when problem substance use is identified, up to 20% of those patients receive no intervention at all. So why is this? Well, I think a major argument for why substance use disorders in adolescents go undetected for so long is that providers haven't been given the adequate tools to detect these issues and to appropriately intervene. So looking at medical education in substance use disorders, medical school curricula offer a total of 12 hours over 4 years dedicated to substance use and addiction. And most of this training is related to scientific pathophysiology, and very little is focused on attitudes or stigma or how to screen patients, or even less time is dedicated to evidence-based treatment of addiction. And as it stands, only about 12 medical schools in the US require a course on addiction, and only 45 offer an elective on addiction. And interestingly, research shows that medical students' attitudes about people with addiction tend to become increasingly negative as they progress through training. And I must admit that as a medical student, I was one of these students who grew to have an increasingly negative attitude towards people with addiction. And I think this is related to the fact that the training just wasn't there. So when I saw people struggling with addiction, it really felt hopeless. And I felt really like I didn't have much control or couldn't do much to help those people. And let's take a look at residency training requirements, specifically pediatrics residency. Here's what ACGME says. There is a requirement for instruction and experience in pain management, if applicable for the specialty, including recognition of the signs of addiction. And that's it. That's the entire requirement for pediatrics residency. And unfortunately, I would say that even this doesn't happen regularly. And in fact, in my residency program, I probably received only about 2 to 3 hours of instruction on addiction medicine related topics during my entire 3 years of residency. So today, I hope that everyone can leave this lecture with a clear understanding of why substance use and addiction really is a pediatric priority. So let's take a look at some of the data. When we zoom out and we look at worldwide trends, we see that mental and substance use disorders are the #1 contributors to health burden among young people aged 10 to 24. Only second to that are things like intentional and unintentional injuries, followed by infectious diseases. So this is absolutely a priority for the young people who we care for. And among young adults aged 20 to 24, alcohol use is the largest worldwide contributor to disease burden. This is incredible, and I think that these numbers are often unknown and under-recognized. And in this country, almost 1/4 of all deaths are attributable directly or indirectly to the use of substances. And furthermore, we also know that adolescents are uniquely vulnerable to problematic substance use and addiction. We know that neurobiologically, adolescence is a time period where the development of substance use disorders becomes a very important issue. We know that adolescents have a fully developed pain and reward pathways in their brain, but they have an immature prefrontal cortex. And here in the image, you can see the classic example of how we know that adolescent brain development occurs from the back of the brain, and the last areas to develop are the areas in the front of the brain, including the prefrontal cortex, which governs judgment and self-control. And we also know that adolescents are the group that is most likely to experience health consequences related to substance use. And consequences include accidents, dating violence, risky sexual practices, and of course, the development of substance use disorders. And for many people, addiction is a chronic illness that begins in adolescence. We know that 90% of adults who suffer from a substance use disorder started using substances before they turned 18 and actually developed a diagnosable substance use disorder before age 20. And younger age at first substance use is an incredibly strong risk factor for the development of substance use disorders. So as an example, 15% of people who have their first drink of alcohol before age 14 will develop a use disorder. And let's compare that to people who have their first drink after age 21. Only 2.1% of those people will go on to develop a substance use disorder. And this trend is absolutely true when we look at misuse of prescription drugs. So a quarter of youth who misuse prescription drugs before age 13 will develop a substance use disorder. And we also know that age of first use is a strong predictor of illness duration. So looking at people who started using substances after age 20 and developed a substance use disorder, they can still be expected to struggle with their substance use disorder for up to 18 years of their life. However, contrast that to those who started using before age 15 and look at what happens to that duration of illness. They can be struggling with addiction for up to 30 years. And early treatment also makes a big difference. So those people who get into treatment 10 years after they started using their substances can still struggle with addiction for about 15 years. However, look at the people who delay treatment by 20 years. 35 years of illness duration is possible. And I would say the 20 years before getting treatment is not uncommon. If we think about a 15-year-old who started using substances, a lot of people don't start treatment until their mid-30s. I don't think this is uncommon at all. So let's take a look at the epidemiology of substance use as a whole in the United States, substance use in both youth and adults. And just to keep things interesting, I'm going to challenge you all to think a little bit about some of these questions that I pose and come up with your best guess for the answer to see if you have a pretty good understanding of these patterns or whether you'll be surprised by some of these answers. So our first question to consider is how many people aged 12 and older in the United States reported using substances in the past month? And the substances include tobacco, alcohol, and other drugs. Is it 165 million people, 140 million, 58 million, or 36 million? So what's your best guess? So if you picked choice A, 165 million, you were correct. This is a staggering number. And let's take a look at data from the 2019 National Survey on Drug Use and Health. This depicts that over the past month, 165 million people reported using substances, and the majority of those report using alcohol, followed by tobacco, and then third most common is our cannabis products. Okay, so same thing, take your best guess here. How many people aged 12 and or older in the US have had an actual substance use disorder in the past year? And remember, a substance use disorder is a pattern of use that is associated with physical dependence, social and occupational consequences, as well as physical and psychological harm. So do you think it's 5 million people, 10 million, 15 million, or 20 million people? So if you picked 20 million people, that is the correct answer. Again, this is a staggering number. And here again is the data and how it breaks down. As you can see, the number one most common substance use disorder is alcohol use disorder. This is followed by illicit drug use disorder and cannabis use disorder. Now, what I find interesting about this data is that they excluded tobacco use disorder, right? We saw that 58 million people in the US report using tobacco. So, and certainly I would argue that tobacco use can cause significant problems to health, to psychosocial functioning. And so this 20 million number may be much higher if we include those people who are struggling with tobacco use disorder. And even for those providers like me who mostly work with adolescents and young adults, it's still really important to have a good understanding of substance use trends overall in all ages, because we know that addiction is very much an intergenerational issue. And in fact, 1 in 8 of all US children are living in a household where at least one parent has struggled with a substance use disorder in the past year. And drilling down into the data, we see that 7.5 million children are living with at least one parent who's affected by alcohol use disorder. And over 2 million children are living in a household where a parent is affected by an illicit drug use disorder. So why is this important? Well, we know some things about children with parents struggling with substance use disorders. We know that those children are more likely to have low socioeconomic status. We know that they may struggle more with academic, social, and family functioning. They're more likely to experience mental and behavioral disorders. And they're at high risk of developing substance use disorders themselves. In fact, children of parents with alcohol use disorder are 4 times more likely to develop an alcohol use disorder than their peers who don't have a parent with this. And interestingly, parental cannabis use increases the risk of adolescent use of a variety of substances, including cannabis, tobacco, alcohol, and opioid misuse. So let's now drill down into the epidemiology of substance use among adolescents specifically. And for this, we're going to take a look at the Monitoring the Future study from 2019. This is a great study that occurs every year. It surveys over 40,000 students from public and private schools. And anytime you're looking for data on adolescent substance use, I definitely want to refer you to this study. So again, let's challenge some of our knowledge and assumptions about adolescent substance use. So the first question is, which substance is most commonly used by adolescents? Is it nicotine, alcohol, cannabis, or prescription drugs? What do you think? So just as with adults, alcohol remains the most commonly used substance by adolescents. So what do you think has happened in terms of trends in the rates of alcohol use among 12th graders over the past 10 years? Do you think rates have decreased, increased, or have they stayed about the same? What do you think? So in fact, we have some good news here. We're seeing that rates of alcohol use among adolescents have actually been decreasing. And here's a representation of that data. So as you can see here, the green represents 8th graders, the yellow represents 10th graders, and the blue represents 12th graders. And as you can see, the past year alcohol use among 12th graders was around 52% in 2019. And these rates are actually at historic lows. Looking back in the early 1990s, these numbers showed that almost 80% of 12th graders reported using alcohol in the past year. So there have been some significant improvements in alcohol use rates in adolescents. And in fact, binge drinking also seems to be on the decline. And this is really important because we know that people who engage in binge drinking are more likely to suffer from accidents, injuries, and are more likely to go on to develop use disorders. So this is a really positive trend. Okay, another poll questions. What percentage of 12th graders reported vaping nicotine on a daily basis? So I'm sure many of us have heard about the rates of vaping increasing in adolescence. So where do you think things stand at the moment? Do we think almost 7% of 12th graders vape nicotine daily, 12%, or 20%? Okay, so if you picked 12%, you were correct. And let's take a look at this data. So first, I'd like to point out that just with alcohol, what we're seeing is that cigarette smoking is at historic lows among adolescents. And as you can see, only about 5%, 5.7% of 12th graders reported smoking cigarettes in the past month. Unfortunately, the great progress that has been made in decreasing adolescent cigarette use has been surpassed with vaping. And these numbers have been on the rise over the last several years. So as you can see, when we look at 12th graders, almost 12% of 12th graders report using vaping nicotine on a daily basis, right? And again, daily use is a pattern of use that's more likely to cause someone to become physically dependent and to develop a nicotine use disorder. Okay. So what has been happening in terms of illicit substance use? And when we're referring to illicit substance use for adolescents, this does include cannabis. So among 12th graders over the past 20 years, what do you think has been the trend? Have rates of illicit substance use increased? Have they decreased? Or have they stayed about the same? What would be your guess? Okay, so what we know is that rates have stayed about the same overall. And here's what the data shows. When we're looking at illicit drug use, it tends to be pretty steady. And this table breaks up any illicit substance use and then also includes a separate number looking at any illicit drug not including cannabis, because we know that out of all of the illicit drugs used by adolescents, cannabis products are the most commonly used. So here we see about almost 36% of 12th graders report past year marijuana use, and then you can see how the rest of the substances break down. But overall, rates are about steady. Now, what about daily cannabis use among adolescents? This is a question that was only recently added to this survey, so we don't have a long history of data on this, but do you think rates have increased in younger adolescents, decreased in older adolescents, or have rates stayed about the same in younger adolescents? Take your best guess. Okay, and here's where we see an area for concern. Again, looking at this data, we see that daily cannabis use has been on the rise. And this is true for all grades, but significant increases have really been seen among 8th and 10th graders since 2018. And here, when we look at past year cannabis use, we see that the rates among the younger adolescents, the 8th and 10th graders, are starting to increase, even though the rates for 12th graders have been about steady. So this, for me, is certainly an area to watch and an area of concern. Okay, another poll question. Now that we've covered illicit substance use in adolescents, what do you think has been the trend in prescription drug misuse among adolescents over the past 10 years? Do you think rates have increased, decreased, or have they stayed about the same? So again, we have a glimmer of good news here, showing that rates of prescription drug misuse among adolescents have decreased over the last 10 years. And here's how that data breaks down. So Vicodin and OxyContin, which are opioid prescription medications, were among the most commonly used by adolescents. And you can see the sharp decreases in rates of use here of both of those medications. So this is really positive. And another commonly misused prescription medication by adolescents is Adderall or other stimulant medications often used to treat ADHD. And we're seeing some positive trends here for 10th graders and 12th graders, with rates of misuse declining between 2014 and 2019. But here again is an area of concern for me. We're seeing some increases in the misuse of these medication among the younger adolescents, the 8th graders. So certainly this is an area for vigilance. Okay. So now let's talk about substance use disorders among adolescents, right? So again, this is a really problematic pattern of substance use that may be impacting an adolescent's social life, their relationship with their family, their functioning in school, and causing harm to adolescents, including getting into accidents or other unsafe situations. And here we're going to look at the 2019 National Survey on Drug Use and Health. And this table represents substance use disorder in the past year among people aged 12 and older. And in this representation, you can see that all people aged 12 or older are represented in the red. Adolescents 12 to 17 are represented in the gray. Young adults 18 to 25 are in the blue. And yellow represents people who are 26 or older. Now, the good news here is that adolescents seem to have the lowest rates of substance use disorders in the past year, right? And that trend has been approximately steady over the last 5 years or so. But my concern here is look at what happens to those young adults aged 18 to 25, right? What changes between 17 and 18 where we see that all of the sudden the rates of use disorders are the highest of all the populations that we're looking at? And breaking this down by substance, alcohol use disorder, as we talked about, remains the most common use disorder that we see. And again, here's some good news for adolescents. So the adolescents 12 to 17 represented in gray, we're seeing rates of alcohol use disorder on the decline. And again, they're the population that has the lowest rates when we compare all ages. But again, here's this trend. Those 18 to 25-year-olds, they're the ones that are struggling most frequently with alcohol use disorder. Even though the rates do seem to be declining, which is a positive. Next, let's look at cannabis use disorders in the past year. And here we see something different, right? Whereas previously the adolescents 12 to 17 had among the lowest rates of all the age groups, here that's not the case. And again, this for me is an area of concern. And again, the pattern continues. The people that are most likely to struggle with cannabis use disorders are those young adults aged 18 to 25. And then illicit drug use disorders, here again, we're seeing a similarly concerning trend. Those younger adolescents, 12 to 17, again, here, they aren't the population with the lowest rates of a use disorder. And again, look at what happens to those 18 to 25-year-olds. This is the population that's most disproportionately affected by illicit drug use disorders. And the other consequential finding from the data is that drug overdose death rates for adolescents have been on the rise. And what we've seen is that disproportionately, those drug overdose deaths can be traced back to the presence of synthetic opioids in the drug supply. So synthetic opioids, including things like fentanyl and carfentanil. And we've certainly seen this in my population in San Francisco. We definitely see that many of the drugs that are purchased on the street are contaminated, including cocaine and Xanax bars. We've seen many unintentional overdoses happening for people who said, you know, I've never used opioids. I thought I was using cocaine, right? But this seems to be a really concerning trend across the country for all ages. Okay, so I want to make sure that we leave here feeling hopeful, because I really do think that there is reason for hope. Again, remember, you know, rates of alcohol use and illicit substance and prescription drug use among adolescents have been declining and in fact are at historic lows. Yes, there's still work to be done. And yes, we really need to be concerned about the increasing rates of drug overdose death. But let's talk about what can really be helpful. So positive social supports and family engagement are really key when we're working with adolescents. So let's take a look at some of the research, right? We know there are several factors in the family, in the school environment, and in the community that help reduce substance use in adolescents. So when we're looking at the family factors, we know that a warm and supportive family environment can reduce adolescent substance use, as well as increased parental monitoring. So parents who do their best to know where their child is, who they're spending time with, who's supervising, those kids tend to have better outcomes in terms of their substance use rates. We also know that a warm, supportive, non-punitive school environment that promotes pro-social behavior is also quite protective. And schools that promote opportunities for positive socialization, like clubs, extracurricular activities, athletic activities, these opportunities can help adolescents to really engage in positive behaviors and avoid substance use. And when we look at community factors, we know that advertising is really an important factor. So, you know, in your community, really pushing for absence of substance-based advertising. So unfortunately, in our community here in San Francisco, we're seeing more and more billboards going up advertising cannabis products. And so this is certainly an issue that has to be addressed. And when we look at juvenile justice programs as well, we really want to turn towards approaches that promote restorative practices, skill building, counseling, and a coordination of multiple services. So really a therapeutic approach to adolescent substance use as opposed to a punitive approach that we have previously taken, as can be seen by some of the poor outcomes that have resulted due to the war on drugs, right? So we really want to recognize substance use disorders as conditions that benefit from appropriate treatment. And out of all of these factors, I really want to focus on family engagement today. And as a pediatrician and adolescent medicine provider, this is an area where I really feel like I can readily make a difference. We know that family engagement actually results in reduction of parent-child conflict, improved caregiver mental health, improved rates of treatment adherence and completion, longer duration of abstinence from substance use among adolescents, and for adolescents who have struggled with use disorders, an engaged family system also helps them have fewer relapses into substance use. Unfortunately, we see that there are many barriers to family engagement. And one of them that I see so frequently is family member ambivalence about the need for treatment, right? So again, just like with healthcare providers who tend to under-recognize the severity of adolescent substance use, family members tend to be subject to the same problem. And oftentimes this is because most youth who are in need of treatment really don't consider their substance use problematic. I hear this every day. And a lot of families also perceive substance use as a normative behavior in adolescence, right? Oh, well, this is just a phase, right? All adolescents are doing this. And of course, a lot of family members have a lack of understanding of what treatment entails, right? The families that I work with often think of treatment as being, sending their kid away to, a wilderness program or somewhere out of state. And so really helping them understand that there are different levels of treatment is really important. And just talking about other barriers, what we find is that initially, when families come into treatment and they're maybe in a moment of crisis, they tend to be engaged, but as time goes on, family members tend to disengage from those treatments because they really see substance use as, episodic, right? Oh, well, yes, my child had a problem with this, but they've learned their lesson. It's not going to happen again. I don't really have to keep worrying about this. Unfortunately, what we know is that addiction actually tends to be more of a chronic relapsing remitting illness, right? So adolescents who have struggled with substance use disorders maybe recover and maybe are in remission from their use disorder, but something happens in their mid-20s, let's say, they finished college and they're looking for a job and they're stressed out. That substance use disorder can come back up. And oftentimes we hear that family members really see that the substance use is the kid's problem, right? So why do I need to be engaged in this? My child is the one that needs fixing, right? So talk to my kid. Whereas in reality, we know that oftentimes substance use disorders are deeply rooted in the family culture and the way and family interactions. Of course, there's barriers such as transportation and scheduling issues, as well as potentially caregivers' own addiction or mental illness, right? I see all of these in clinical practice. However, we also know that family engagement is really key for adolescents who need treatment of their substance use disorders. And we know that although adolescents often don't see their substance use as problematic, they are highly influenced by their parents' recommendations to enter treatment, right? So in a survey of adolescents with various mental health problems, 91% of those adolescents reported that their parents were the most influential to their decision to enter treatment, even though they may not have been really excited about treatment or thought they needed treatment, right? So parents. And we know that parental involvement in adolescent treatment predicts much improved treatment retention. So kids stay in treatment longer. And when parents actually are engaged and utilize the treatment services that are offered, we see that their children, those adolescents, have decreased rates of substance use. So for all of these reasons, in our adolescent treatment program, we definitely take a family-based approach and encourage parents to be involved and participate. And unfortunately, a lot of the patients that we see in clinical practice, again, really don't want to be at our clinic. The adolescents really don't see that there's a problem. They don't think they need treatment. They'd rather not be there. So sometimes the family really feels like, they're dragging their teenager in, kicking and screaming into treatment. And so, of course, we wanted to kind of look at this and see, is this an appropriate model for getting adolescents appropriately treated? And what we find that externally motivated treatment that's really encouraged by parents can be very effective for adolescents, right? However, there are certainly differences in the way that this is approached, right? So there are differences in the subjective perception of external treatment pressure. And those can result in different therapeutic alliance outcomes, right? So what we often talk to parents about is really thinking of how to present treatment, right? So because we know that external treatment pressure that uses threats or consequences results in that adolescent having less internal motivation and in turn having less therapeutic alliance, right? So that kid is less likely to really engage in services, less likely to stay into treatment, less likely to have buy-in, as opposed to external treatment pressure that comes out of genuine parental concern, right? Parents who say, you know, I hear that you don't want this treatment, and as your parent, I love you so much and I care about you so much that I have to find some way to help, right? This is really the approach that results in adolescents having more acceptance that treatment is necessary for a better future, more internal motivation, and better therapeutic alliance. So those kids are more likely to really participate in treatment services, to stay in treatment, and have better outcomes. So I think we as providers can really provide some education and guidance to family members on how to approach their adolescent substance use and how to engage them in treatment, right? So I think it's really important, first of all, to educate families on neurodevelopmental issues related to substance use. So really talking about addiction as a brain illness is really important. A lot of parents, unfortunately, really see their child's addictive behavior as, you know, a kid who's just being bratty or making poor life choices, right? So we spend a lot of time really educating family members on what happens in the brain when addiction is present. You also want to provide definitions of substance use disorders, right? Yes, some substance use in adolescence may be normative, right? Teens take risks, but how do we define a substance use disorder? When is that substance use disorder turning into something more than just experimentation, right? A lot of family members have a hard time making that distinction. So we as providers can really educate and remind families about this issue. We also want to remind families that substance use disorder really tends to follow a chronic, remitting, relapsing disease process, right? So for those family members that say, oh, well, you know, Johnny learned his lesson, it's never going to happen again, we really have to warn them and provide some anticipatory guidance in that this is something that may come up again. And we do need to stay vigilant and supportive. And of course, counsel families about evidence-based treatment options for substance use disorders. Now, this is really a passion of mine. You know, in our youth outpatient substance use program, we really focus on what is evidence-based when it comes to adolescent-specific addiction treatment, right? And unfortunately, there are many programs out in the world that have a very eclectic approach to adolescent substance use and don't necessarily use evidence-based practices, right? So it really is our job to become informed on what is evidence-based and counsel families on what to look for when they're looking at treatment options for their youth, right? And the bottom line here is that most of the most effective strategies for adolescent substance use are family-based strategies. And you can also help those families by providing guidance that externally motivated treatment, you know, treatment that is really encouraged by parents can be quite effective for adolescents, right? But again, really guiding those parents on how to present that, right? Not the threats, my way or the highway, but really presenting it as something where the parent cares so much about their child that they feel like they have to do something to help, right? So even if a kid doesn't want to be in treatment, doesn't want to engage, that influence of parents to encourage them to receive that treatment can be really powerful and really effective. And again, become familiar with local treatment programs that utilize evidence-based treatment strategies. This is one of the most challenging things that I help our families navigate is, you know, a family member may come to me with a list of programs that's approved by their insurance and ask me, hey doc, which of these programs should I send my kid to, right? And really taking the time to learn about each one of these programs, Sometimes I'm even calling up the medical directors of these programs to ask them what services they offer and what evidence-based practices they use. But I really think that having a lay of the land and being able to recommend the most appropriate treatment options for families is a great service that we can offer as providers. So here we are. I want to just emphasize some of the conclusions that I hope all of you were able to gather from this talk, right? So number one, problematic substance use among adolescents is often under-recognized by healthcare providers. And I'm of the opinion that this is really due to a lack of education on this topic. So this has really become one of my passions, is expanding education opportunities to healthcare professionals so that we start recognizing substance use disorders early and knowing how to appropriately address them. We also know that mental illness and substance use are major contributors to health burden among youth, and they certainly negatively impact outcomes into adulthood. So this is absolutely a pediatric priority, no matter what age of patients you typically see in your practice. All providers should really be well versed in this issue, knowing how many people addiction affects. We also know that rates of alcohol use and cigarette smoking among US adolescents are continuing to decline. So this is a piece of good news that we have. But unfortunately, nicotine vaping and daily cannabis use are areas of concern. So we as providers really need to be vigilant about these issues and keep an eye on the data. This is certainly a concern for me. And next, while rates of prescription drug misuse are on the decline in adolescents, rates of overdose death are rising, right? So there's still so much work to be done to address prescription drug misuse in adolescents. And finally, positive social supports and family engagement are key factors for addressing problematic substance use in adolescents. So absolutely get family involvement, educate parents about the realities of addiction, and really try to be informed and act as a guide for those families who may be really struggling with this issue. So with that, I thank you all for your attention. I really appreciate the opportunity to speak to all of you on this topic, and I will turn it back over.
Well, thank you. Thank you so much for sharing your expertise with us on the epidemiology of adolescent substance use and really sharing with us the most recent data, as well as really helping us to understand that really important role of family caregivers, not just providers, which is clearly very important, but family members are so central in supporting adolescents, helping to engage them in services, substance use disorder treatment, or other types of care. And so I really just love hearing so much about that piece that I think we need to pay even more attention to. So thank you for raising that up and helping us to really understand that role. We often focus on the provider role, but it's clear we need to be paying much more attention to the role of family. So thank you so much. Well, in our last few minutes together, just as a reminder, our team will be sending you a follow-up email later today, and that's going to include links to the PowerPoint slides, the on-demand recording, a very brief survey, and of course, instructions on how to claim your free CE certificate. If you want to access any of these things now, before the email arrives, you're welcome to do that by going to the webinar website, espert.webs.com/adolescent-epidemiology. And also, just want to share with you a few more resources. If you're not aware of these, I hope you will take a look. There's just so many incredible resources available through the ATTC network. And just a few of them are listed here, but you're just thinking about what we just heard and the importance of addressing cannabis use and vaping. There are some, complimentary recorded webinars on these topics available to you right now. And in addition to that, we also heard about the developing brain. As I mentioned earlier, there is a webinar on the neurobiology, but also you can see here there is other webinars around understanding suicide as part of adolescence and the changing brain. So I hope you will take advantage of all of these. And of course, we would love to have you keep in touch with the ATTC network, and you can do that on Twitter and on Facebook. You can also sign up for a monthly messenger, which is a monthly publication that is free and available to you, and you can go to this web address and sign up. In addition, if you're not familiar with the PTTC network, there is also a whole host of complementary, again, very complementary, not duplicative. So once you explore the ATTC network resources, I hope you will go over to here and take the advantage of these as well. Yes, there are some additional resources on addressing vaping. But also vaping in specific adolescent populations, LGBTQ youth. And you're also going to see other resources addressing other substances, opioid use, for example. So again, take advantage of these. Also, not just recordings, but they're downloadable resources. There are pocket guides and evidence-based practice resources. We've heard about evidence-based practices a lot today. So there are resources available to you by download by going to these web links. And of course, we want to keep in touch with you through the PTTC network, and that has a different monthly publication called The Post. You can subscribe going to this link available to you, and you can also visit the PTTC network on Twitter and Facebook. And with that, I'd just like to thank you so much for attending, and again, Veronica, for your incredible expertise on this topic. And with that, I will conclude today's webinar.